All these forms I have to do, I'm tired. Form after form after form after form. I need someone to be filling in this information. Our first test of the day was the MRI. To be honest, I always thought an MRI and a CT scan or CAT scan were the same thing. Little did I know that the MRI would be a completely different experience compared to that of a CT scan. Understanding cancer testing can feel overwhelming, but it's crucial for effective diagnosis. Imagine it as an investigative mission exploring the insides of your body. Cancer testing employs several methods to diagnose the disease. These include taking tissue samples, using imaging techniques to identify tumors, analyzing blood and urine, and conducting screening tests to detect cancer early. The specific tests selected depend on the type of cancer suspected and its location. It's not a one-size-fits-all scenario. Rather, it's like a custom-tailored suit designed just for your unique needs. Let's take a look at the various types of cancer tests that are commonly used. First up, we have biopsies. Their purpose? Well, this is the most definitive method for diagnosing cancer. A biopsy involves collecting a tissue or cell sample for microscopic examination. The process? Well, physicians look for abnormal or irregular cells that may indicate cancer. It's like searching for a needle in a haystack, except this needle is an unruly cell. One intriguing tool used in biopsies is the mag seed. This small magnetic seed is strategically placed at the tumor site to enhance the accuracy of the tumor localization during breast biopsies. Think of it as a GPS for tumors, ensuring we stay on the right track. Additionally, the mag seed serves as a form of tumor marker. This is especially useful in cases where chemotherapy has eradicated the tumor, making it invisible. Physicians rely on the mag seed to pinpoint the physical location where the tumor once was. Image or imaging tests. Purpose? These tests evaluate bones and internal organs to identify and stage tumors. Examples include computed tomography scans or CT scans, which utilize X-rays to create detailed images of the body. Think of it as a high-tech photo shoot for your insides. Magnetic resonance imaging scans or MRI scans use magnets and radio waves to capture clear images. Unfortunately, you won't get a copy for your scrapbook. Ultrasound. This technique employs sound waves to produce images. Positron emission tomography scans, or PET scans. These provide images that reflect the metabolic activity in tissues. It's like a metabolic party, and we're all invited. Laboratory tests, or lab work. Purpose? To identify abnormalities in body fluids and tissues that might indicate cancer. Examples are blood tests. These can uncover abnormal cell counts or types. For instance, a complete blood count, CBC, can help diagnose leukemia, and some tests can even detect tumor markers. So yes, your blood might just give a few surprises up its sleeves. Urinalysis. This involves analyzing urine for chemical components that may signal cancer. Don't worry, it's just a fancy way of saying we need to check your pee. Screening tests. Purpose? To catch cancer in its early stages, especially in those asymptomatic individuals who may be at higher risk. Examples? Mammograms. These are specially designed for breast cancer screening. Just a heads up, availability of free mammograms and the eligible age can vary by country and healthcare system. So make sure you know the rules before you schedule that appointment. Colonoscopies. These tests are our go-to for detecting colon cancer. Think of it as a deep dive into your digestive system, minus the tropical vacation. Pap smears. This test collects cells from the cervix to screen for cervical cancer. It's a bit like quality check for your reproductive health, because who doesn't love a good checkup? Factors influencing test selection. The symptoms. Tests are often performed to investigate symptoms that might be related to cancer. So if you're feeling a bit off, it's like your body's way of sending an RSVP to the doctor's office. Risk factors. If you have a family history of cancer or specific genetic mutations, you might need targeted tests. Think of it as your genes giving you a heads up. Type of cancer. The suspected type of cancer will determine the most suitable screening and diagnostic tests. It's like picking up the right tool for the job. No one wants to use a hammer when a scalpel is called for. Just come back from having an MRI, and unfortunately didn't go as well as I thought it would. I had a panic attack and I was claustrophobic. I didn't even know. Rachel had to sing to me, can you imagine? And calm me down, and I was crying, and oh my God, it was something. But you know, the lady was great, the radiologist was great. She was like, don't worry, it happens to the best of us. And even she said when she went, she also had the same thing. So yeah, that was that. Now we're off to have the biopsy, the fine needle, whatever, fine needle biopsy, right? And yeah, that's where they'll remove a chunk or a few chunks of the tumor, and then they'll leave some tumor markers in there, just to say that to make sure that the tumor's in there. No, make sure that later on
they can see whether it's shrinking and what size it was and exactly where it is, where it was.
Yeah. When they come and check again, because after a few rounds of chemo, the tumor shrinks, and then sometimes you can't find where it was, so they have to put tumor markers. So we'll keep you posted. But yeah, that's the story of the MRI. I just hope I don't go there again, because no.
Remember the older brother.
Oh yeah, I started calling my brother. I want my brother. Oh, that's a bit embarrassing, right? That was funny.
Well, at least it's done.
Yeah, it's done.
Yeah.
It's done.
That's the most important thing.
Yeah. All right, guys.
Outcome.
Catch you later. We wrapped up the day with a visit to the mammography center, where I had a mammogram, an ultrasound, and a fine needle biopsy on both the tumor and the suspicious lymph node in my arm. All that was left to do was wait. Luckily, we had a phone appointment scheduled with Professor Ben, who was in the United States presenting at a conference. Our Zoom appointment was set for that Sunday, just 2 days away. This time, though, the wait for the biopsy results wasn't as nerve-wracking as it was during my first one with Dr. Khan back in March. Hello. So it's day 3, evening. I've just come from having my biopsy done. So I had a mammogram first, and then I had an ultrasound, and they were checking for any growth in the tumor and if the lymph nodes are affected. Unfortunately, there was a suspicious lymph node in the right arm, and so
I had a biopsy both on the actual tumor itself in the right breast and in my right arm. Then they took out 3 chunks on each spot, and there was a marker already, a tumor marker already, and the chemo from my previous biopsy, but they also put a marker in my arm, a tumor marker in my arm, so that after chemo, sometimes they do disappear. So they want it's just a little, it's like a titanium little thing that they put just to say the tumor's here, and it doesn't move. So that when chemo is done and if the tumor does disappear, they'll know that the tumor was actually there. Yeah, overall, the biopsy and the mammogram went okay. I think because I kind of knew what to expect, but the thing that threw me off was the MRI. Oh my gosh, that one. I don't want to do it again. I was claustrophobic. I was screaming. I was, crying. And I just felt like I couldn't breathe. I just, and it was 25 minutes and I had to stay still. And it was just, it wasn't pleasant, but luckily my sister, Rachel, like calmed me down. She was singing, and it was so like relaxing for me, and I managed to do it and stay still because they used the results when checking the mammogram, and when doing the biopsy they used the MRI images here. So yeah, so tomorrow nothing much is planned. We have to wait 4 to 5 days for the biopsy results to see, and I guess it will tell us the staging, and also tell us when how or what, it will give us a concrete map on what or how much immunotherapy and chemo to be done, and then yeah, I guess we just have to wait until we hear the results. I'm just waiting also to hear from the cardiologist and the dietitian. But overall, it's been an interesting and packed day. I've been probed and poked and moved and yeah. So I think I'm gonna get some rest. I'm not allowed to use it like lift heavy stuff for the next 3 days until the biopsy sort of like heals the wound or the little fine, because for as much as it's a fine pin prick, the needle really goes into the mass. Oh yeah, and then they found that the mass is we thought there were 2 tumors or 2 cysts. It's actually one, and had a bridge. It had a bridge on it, so it's like they're very close together, but it's actually one, because when she really magnified into it today, it's actually one tumor, but in the shape of like an 8, and the part, the little part where it becomes 8, that's the bridge. So yeah, so she was saying, and then it's a complex tumor, so it's basically got a solid mass as well as a liquid mass component to it. So it's not just solid. Yeah, so it's quite complex, but the doctors are excited to see how they can, reduce it, and yeah, they're full on, and everyone is so professional here. I was really looked after. Yeah, so that's it, really. That was day 3, and yeah, I'll wait to see what comes next. So, as you can hear, that's a recording of our telephone consult with Professor Ben, and good news! Biopsy results are out, and lymph nodes are clear. Clear, clear, clear. Thank you, Lord. And what else did she say? Oh gosh.
Kidney is clear.
Everything is clear. All, yeah.
All suspicions are clear.
Clear. So it's triple negative cancer, it's not hormonal, and it's totally treatable. And then she says the TILs, which is the, oh, oops. What's the TILs again?
You wrote them down. Anyway,
And I
typed
think,
them,
yeah. Well, anyway, the TILs at 30%, which means that that's a really good amount and good percentage to have. And yeah, so.
And it's early stage.
Yes.
Yeah.
Very early stage. And yeah.
Yeah, and we're with the best oncologists in the world.
The world.
In the world.
So yeah. Yeah, so we'll give you a heads up when we go to see the oncologist, because treatment should start in the next 5 days. And yeah, we'll keep you posted. So yeah.
These people don't play. You even have a life coach, an oncology life coach,
and dietitian.
Yeah.
Oncology dietitian, huh? They don't play.
No.
No.
I'm busy. I just heard about your journey about a week, and maybe a week or two ago, but I just want to wish you well. I know you're courageous and I know you're strong. I know you can make it through this, but I'm wishing you well, praying for strength, praying for peace, and I know God will see you through this journey, and I know you're strong. I know you're courageous because I know you. So I just want you to know that you're not walking alone. On the days that you feel down, just know that there's others that will be there for you. I'm wishing you well, cuz I love you, and praying for the best.